I'm going to begin with just a small comment to piggyback off on that. Sorry, I don't want to cry. I take a medication that costs over $4,000 a month. If I don't have that, I become a cripple at 55 or 60. Sorry.
No, go ahead, Laura.
Ethically, do you see it as your responsibility to ensure that a state cannot offer a waiver so that they abandon me? That's my first question. Go ahead if you want to.
Okay, the states offer.
So if a state brings an offer of a waiver to the head of the Department of Health and Human Services and says, we want to do these certain things so that suddenly, what is affordability? Am I going to be paying 50% of my take-home pay for my insurance, and they determine that as affordability? Who decides affordability?
Well, the secretary would decide affordability, but as we're going through with the battle that Iowa is having right now in trying to obtain a waiver for Obamacare because folks can't afford it, they have to prove that insurance is unaffordable, and it is a struggle right now. So they would have to prove that it is not affordable for you.
So I am appreciative of Doug Omen's work on that waiver. Yes. It has been superb, and I think insurers have promised to come back into the state if it is approved.
We are hopeful.
He said today that the federal government may. The question, sorry, I felt so personal about that.
No, and that is very personal.
The other thing that feels very personal is I'm from Decorah, Iowa. We are in a rural area. The Medicaid cuts that are coming are going to affect every sector of our healthcare. So when it comes to, first off, poverty levels, the first users of Medicaid are those who are poor. If you look at the census data in 2010, the 4 counties in the Northeast are increasingly more and more poor. So they need that. Our rural Iowans need Medicaid, and to cut those payments is egregious morally to me. Second, our hospitals. Our hospital administrator came and spoke with Brittany when she came to us in Decorah and said, we need those Medicaid payments because we need to have our bills paid. We do work, we should get paid for our work. So our rural hospitals are saying, this is a problem. So there's another sector of our economy. And then you go on to our clinics in the area, and you have voted against Title X, and our clinic in Decorah closed on June 30th. It didn't even offer abortion.
Laura, what clinic closed?
It's the Northeast Iowa Family Planning Clinic.
Okay, through Planned
Parenthood. It closed in June 30th, and it was lacking Title X funding, and so that is a lack of access there, and we're seeing that across the state as well. And then the last sector of our healthcare is these small clinics, say, for mental health. They have said, now it's a dynamic duo of the state privatizing healthcare, privatizing Medicaid, so that they're not getting paid. And they joke about counting their toilet paper squares because they're not getting their bills paid. And then you're going to come along and decrease the amount of money you're giving them through cutting and doing Medicaid block payments. We already have a crisis of mental health in Northeast Iowa. We lack psychiatric nurses, nurse practitioners. I talked with the county commissioner, and he said we can't even get them to come here because they're too expensive. Are you then going to close that small clinic that we need because it no longer has Medicaid payments? So how are you going to justify to rural Iowa a vote in favor of Graham-Cassidy that cuts Medicaid and affects every sector of our healthcare economy?
There are a lot of issues there. One, and I want to go back to your medication issue as well. And again, what I'd like to remind everybody is that what we have been talking about and what Obamacare was is an insurance bill. Obamacare was insurance, it wasn't health care. So we're addressing insurance, but Laura, what you brought up with the medication issue is health care. And nowhere have we addressed the actual expenses of health care. So that's what I want to remind everybody is when we're talking about medication expenses, you know, why is it that a medication will cost $4,000 a month? There are a lot of issues within the pharmaceutical area that we need to probably address so that if you have a life-saving drug, it's not costing you so much. There are other issues with regulation and overhead that so many of the providers and practices and clinics have to put in place. One, we want to make sure patients are treated safely, but there's a lot of unnecessary regulation and paperwork now where our physicians are saying, I'm spending more time doing paperwork than actually seeing patients. And that doesn't bring any dollars into a clinic. It doesn't bring any dollars into their hospital if they're not seeing patients. They're just doing paperwork. So there's a lot of issues with actual health care that have yet to be addressed. And I do hope that that's something that we will focus on as Congress, you know, what's going on out there within health care and what can we do to bring those costs down. So that's one. You mentioned Medicaid, and the Medicaid dollars, even through the Graham-Cassidy bill, will continue to increase every year. So if you look at what's being expended in this current fiscal year, it's not going to decrease, it still increases, especially for those that are disabled, which we have a number of disabled in Iowa as well as our elderly. So that will continue to increase 2020 through 2026, which is the period of time covered by the Graham-Cassidy bill. So to say it's a cut, it may be a cut from what was projected in Obamacare right now, but it still will increase, and it will increase, continue increasing for those, like I said, that are disabled and elderly, the most vulnerable in our population. As far as the clinics that exist out there, there are a number of funding streams. Title X is only dealing with family planning services, not entire services, wellness and things like that. And there are many other federal health clinics, qualified health clinics across Iowa, and we've actually spoken to that association, and they have said in regards to Planned Parenthood that even if those Planned Parenthoods would close, they can accommodate those patients. So there do exist a number of those clinics, and then we also have community hospitals. Rural hospitals, I live in Montgomery County. We have a rural hospital as well. So we're well aware of those issues. In regards to mental health, this is a crisis all across the United States. It's not just in Iowa. And it's not just about lack of funding, it's a lack of providers as well. We don't have people that are entering into going into those services like psychiatry, counseling. We can always use more of those. So it's not just lack of funding overall, it's just simply lack of providers that are available out there. Some of the biggest hospitals you'll find out there say they struggle, even offering high dollar amounts, they struggle getting psychiatrists. So there are a number of issues that need to be addressed. They won't all be addressed in this particular bill, just as they were not addressed in the ACA.
First off, you can say there are clinics all over. We are in the middle of Northeast Iowa. It's an hour and a half to drive. If you expect poor women to do that, that's a hardship. So please consider those women. And then the second matter, we have people in Northeast Iowa, there is healthcare for mental health. They go to Minnesota. They plan it ahead of time and they go. It is an Iowan issue.